Okay, let's do this. Barrett esophagus, page 1592. Barrett esophagus. So it's basically a condition of extreme and chronic irritation of the lower esophagus. It changes the esophageal lining cell formation from the normal squamous cell type to the columnar cell type, which is found in the stomach's wall. Barrett esophagus is thought to be a pre-cancerous condition that requires careful medical management and annual endoscopic surveillance for the development of malignancy. Blah. So basically, with GERD, you have the constant acidic environment of your stomach, the gastric juices going into your esophagus, changing the cell lining, causing cancer. That sucks. So as long as you can prevent GERD and help them with that, you can prevent anything like this. Esophageal cancer is the cancer of the esophagus, is most common in men and in smokers. It is also associated with alcoholism. Esophageal cancer often is diagnosed late in its development, and the client's prognosis is usually poor. That sucks. Signs and symptoms. So early clinical manifestations is dysphagia, difficulty swallowing. Okay, so treatment, and usually it's something you find like later on, so you don't look for it right away. Surgery is the only effective treatment for esophageal cancer that allows the client to eat normally. So then we're going to go on to disorders of the stomach, page 1593. So gastritis, stomach inflammation, commonly called indigestion, occurs in acute, chronic, and toxic forms. So just know that a lot of the time the gastritis can be precipitated by either medications or any sort of irritating thing in your gut. Some people are more sensitive to other things. Also, another thing is what's called H. pylori. So treatment of gastritis involves in removing offending foods, medications, and H. pylori. H. pylori is linked to several disorders of the GI tract, and that just means you need to do extensive antibiotics. I think we've already talked about it. Okay. Toxic gastritis is also following indigestion of a poison, so characterized by burning stomach pain, cramps, nausea, vomiting, and diarrhea. Again, call poison control, understand what it is, how to treat it, and to take care of it as quickly as possible. So then we have what's called peptic ulcer disease. An ulcer is an open sore in the skin or mucous membrane that is accompanied by sloughing of inflamed and necrotic tissue. So the peptic ulcer refers to break in the integrity of the mucosa of the esophagus, stomach, or duodenum. So the presence of the gram-negative bacteria Helicobacter pylori, H. pylori, is strongly associated with peptic ulcer disease. That little bacteria sucks. So that's what's going on. So ulcers can be caused or worsened by use of NSAIDs as well, including aspirin, ibuprofen, or Plavix. So just a heads up. So just know that ulcers can bleed as well, and the special consideration is the risk of bleeding is greater in older people, especially if they're taking NSAIDs such as ibuprofen or aspirin. So there's different signs and symptoms. Just know that they could have black or tarry stools, especially if the ulcer is bleeding. So black and tarry stools containing blood is a sign of upper GI bleeding, which is related to peptic ulcer bleeding. So checking for the fecal occult can show that as well. Complications of this, you could have an abdominal infection because that lining is so vulnerable. You could have infection from that. An obstruction from like scar tissue could build up to the point where it obstructs food passage, and you could have hemorrhage. So just crazy amount of bleeding coming out of there. And if you see a lot of bleeding, you're going to see things like coffee ground emesis. So they're going to vomit blood, but it's going to be that coffee ground, and it's not going to smell great, and you're going to think, oh my gosh, this is not good. So endoscopic procedures can be performed to seal off the bleeding vessels, so that's really good too. So there are ways to help and fix that. Another thing is you're going to see perforation possibly with the bleeding ulcer. So then you're going to see perforation occurs when an ulcer penetrates the wall of the stomach or intestine, allowing contents to escape into the abdomen, causing peritonitis. Blah, that sucks. So this could begin, so the symptoms for this is sudden, viciously sharp abdominal pains. When that happens, they're going to come in not feeling great, give them pain control, and figure out what's going on. So medications, antibiotics, you got to eradicate that H. pylori. You got to get rid of that sucker. So with any antibiotics, though, they're at risk for diarrhea. They're at risk for ruining the normal flora in their gut. So you have to give them probiotics or recommend probiotics either in supplemental form. Yogurt, kefir is one of them. But there are lots of good things that can, it's so important. Your gut health is your entire body health. So then it talks about different medications to give them. A whole nice page about it on page 1595. The diet therapies, so the frequency of meals. Just read about it. Keep it aware of the medications because you will see it in your practice. And just also tell them that the client should also emit from coffee, tea, cola beverages, chocolate, alcohol, and cigarette smoking because they stimulate secretion of hydrochloric acid. You don't want that over secretion of that because that can only irritate the ulcer more. Just a heads up. So cigarette smokers are twice as likely to have ulcers as non-smokers. Alcohol use also predisposes a client to ulcer formation. So if they're crazy drinkers and heavy smokers, bite it in the butt if you can help them. So encourage the client to verbalize his or her concerns rather than to internalize them. Things with like stress can also precipitate this kind of stuff. So help them just de-stress their life, help them clean up their ingestion of toxic things, and just help them out. Patience, patience, patience. So NCLEX alert. GI problems are commonly seen in healthcare facilities. NCLEX questions may require knowledge of the medications used for treatments, signs and symptoms of disorders, complications of GI problems, and interventions by the nurse. So just a quick thing. At the end of like your 5th term or during your 5th term, you're going to do a lot of NCLEX practice, and that begins also in your 4th term. So don't freak out. You will know this stuff. You'll get it figured out, and you'll do great on the NCLEX. Just give yourself time and give yourself the amount of time you need to study for this test. If you don't feel like you need to take it right after graduation, that's okay. I waited a month after I graduated to take my NCLEX. So just know how to study, what works best for you, and how to make you more successful. That's the key, okay? Because nobody else is going to do this. It's on you. What gets you to be the most successful person that you can be, that's what you need to do. Okay, so page 1597, stomach cancer. Stomach cancer is known as the silent neoplasm because it is usually not detected until after metastasis to adjacent structures. So you really don't know about it until later on, until the symptoms are too far along. So symptoms include sudden dyspepsia, indigestion, unrelieved by eating, which is the most important symptom. And then just know that you're going to see coffee ground emesis again. It's that bloody type emesis in the absence of free hydrochloric acid in the stomach or other significant findings. And you can have 8 blood breath tests and things like that that go with it. Okay, so, and then the treatment generally involves surgery to remove the tumor completely. So then what's common with stomach cancer is metastasis to the spleen, lymph nodes, liver, pancreas, and esophagus is common. Usually the prognosis is not great, so client and family grief counseling may and probably will be necessary. Call the chaplain at the hospital. Call people that are there to help you because you as the nurse, as much as you want to talk with them, you won't have time. So call the people that have the time and the knowledge and the experience and what to say and how to say things into the situation. Because at a time when you do have time, it'll be wonderful. But when you don't, they'll still need help, like with grieving, with diagnosis or anything going on. So that's really important. So box 88-2 has a nice little differentiating columns about the differences between ulcers and stomach cancers. Take a look. Put the big ones in your head to remember the biggest differences between the two. So just know that ulcers, frequent dyspepsia. So let me make sure I know exactly what that was again. Indigestion, whereas stomach cancer is that sudden dyspepsia. So, and then the coffee ground emesis, and then stomach cancer, and then just ulcers, just like that, like the typical. Where stomach cancer is usually, once it's too far along, it's very sudden when you find out. Okay, we're doing great. Sudden disorders of the small or large bowel. So, diverticulosis or diverticulitis. Diverticulosis refers to a condition in which outpouches or ruptures occur along the intestinal wall. So, diverticuli can occur anywhere in the GI tract. So, endoscopy can confirm the diagnosis by permitting direct visualization of the lesion. So, that's when they do the colonoscopy. Diverticulitis occurs when the diverticula become inflamed, usually because of diverticular obstruction and bacterial invasion. So again, it's like those weird little pockets in your gut that things get trapped under, and then if it just bruise, infection is going to happen, and then you're just going to have really bad stomach issues. So they're usually treated with antibiotics. and then just rest. So dietary management's important. So don't eat foods like they always recommend like little kernels, like a popcorn kernels or things like that. Things that are going to be easily trappable along that gut line. Avoid eating that kind of food if possible. So consumption of high residue foods is recommended to prevent the formation of diverticula. Let's see here. And then so just know when fever and abdominal pain are present, indicating infection along with inflammation, antibiotics are prescribed. Almost like 99.9% of the time, I had patients with diverticulitis. I gave them antibiotics right away. And it usually helped them. Okay, so just know it's a lifelong thing. They're going to deal with it. That sucks. So, hernias. I'm going to read this entire thing because it's just a perfect explanation of it. Hernias develop when abdominal muscle weakness causes a portion of the GI tract to protrude through the muscle. So herniation often occurs when intra-abdominal pressure increases because of obesity, heavy lifting, coughing, blunt trauma to the abdomen, or pregnancy. So coughing, I could feel my stomach being like having pressure on it. My uncle, I feel so bad for him. He was doing crunches and working out. Boom, he got a hernia. I felt so bad. So he's like, I don't work out anymore. So, anyways, though, so a hernia, I'm not laughing, but a hernia may be reducible, irreducible, incarcerated, or strangulated. A reducible hernia is one that may be pushed back into the intestine by lying down and pressing on the abdomen. An irreducible hernia cannot be manipulated back into the body cavity. An incarcerated hernia occurs when the intestine's peristaltic flow is obstructed. A strangulated hernia requires immediate surgical intervention because it interrupts blood flow to the tissue, resulting in tissue necrosis and infarction. So that is literally like the perfect boom thing of a hernia. Google every single one of these so you have a better visualization. But I don't know if you've ever seen Friends, but there's an episode on it where I think his name is Joey. Anyways, though, he has this hernia in his stomach, but he doesn't have health insurance, so he's trying to get a job in the acting industry, and he finally gets one. He gets the insurance, and he goes back into the hospital to get treatment. But they're extremely painful, and they are not fun. And it says, like, usually, like, if there's a mesh in place, like, if they put a mesh for, like, their treatment, they can go back to lifting. I know my dad had a hernia, and he has a mesh in place, and he's still, like, he'll feel it if he lifts too heavy. So this can sometimes be a lifelong thing that they have to deal with, which is not fun. So as much education as you can and helping people understand, just like don't lift heavy objects. You see these like freaking like super power lifters on TV and you're like, oh my gosh, I'd probably pop my entire stomach. So gradual building up is important when you're doing any heavy lifting or anything like that. Okay, so there's different types of hernia like we talked about. Just know that congenital defects are responsible for many hernias. So one of my little sisters had an umbilical hernia when she was a little kid. And I'm like, what the heck? And then there's inguinal hernias are the most common type of hernia. So inguinal is like you have like, just Google a picture of it. I'm not going to do a very good job explaining it. But that's a really common hernia. And you probably will see that usually in like the younger adolescent. So let's see here. And a lot of the time though, when they do hernia surgery, a lot of the time it's outpatient, which means the patient will be consulted with the doctor or the surgeon, and then they'll go home, they'll eat one meal, they will not eat after midnight, and then they'll wake up, and then they'll go to surgery, and then they'll be in the surgery for however many hours. They'll hang out in the recovery room, and then there's somebody that's with them will take them home, and they'll go right back home. It's awesome. They don't have to stay the night in the hospital, which is always a good thing. So those are hernias. Basically, intestinal thing coming through the abdominal wall. So, intestinal obstruction, page 1599. Ileus is obstruction of the intestine. It may be caused by mechanical or functional difficulty. So, mechanical obstruction occurs when there is a blockage in the lumen or pressure exerted from outside the intestine. Examples include stenosis, volvulus, twisting of the bowel. Literally, like, here's your nice folded gut. Some of it will literally, like, be twisted. So, here's your string, you twist it. So then it's, like, just blocked. Not good. Super painful. Foreign bodies, such as a fruit pit, just, like, stuck in there. Then you have what's called intussusception. So it's basically, here's your, like, your intestine. it like folds in on itself. It's the weirdest thing, but that can happen. That's also very painful and obstructs flow, not good. Then you have polyps and tumors like diverticulosis. Abscesses can just form. And then you have what's called functional obstruction occur when the intestinal motility, peristalsis, is defective. So those include like a paralytic ileus just not functioning very well, muscle spasms like that just prevent the flow of it, and disorders such as muscular dystrophy, diabetes mellitus, Parkinson's disease, things that just like prevent normal peristalsis to happen. So all of these things can be painful, not fun. And you're going to see with them abdominal distension, severe cramps, nausea, and vomiting are very typical. Very, 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 very typical. So the client is usually listless, generally weak, thirsty, and has a feeling of fullness and constipation. So if left untreated, the client will become very ill with symptoms of dehydration and shock and will probably die. So anybody that has any sort of obstruction, super important to be taken care of. Once you put it in, you got to get it out. And if it can't come out, something's wrong. So it can be an emergency, so just know that as well. Okay, so treatment usually involves decompression, such as like an NG tube, to help get things out of the stomach to help decompress and help get that gut relaxing again to help the flow, see if that'll help. If not, surgical intervention is necessary. Okay, so colonoscopy may be done to attempt to untwist or unblock the bowel as well. Then you have irritable bowel syndrome, IBS, is also known as spastic colon, spastic colitis, mucus colitis, and irritable colon. This condition is the most common functional disorder of the GI tract, which causes increased motility of the small or large intestine. It affects the intestine structure, but its specific cause is unknown. IBS does not lead to or cause ulcerative colitis or cancer. Basically, they just have frequent bowel movements. I don't know if you're lactose intolerant, but when I am, and I eat ice cream, whoopsie daisy, I gotta go. So just know that could be, I don't have IBS, but that could be like, just like a way to remember it. So you're gonna see nausea, abdominal pain, cramps, gas, even constipation depending on the situation. Like, it's just like, you're just gonna have a really frustrated gut, I guess you could say. So just know though that rectal bleeding and fever are not associated symptoms of IBS. The person with these symptoms should report to a healthcare provider for evaluation. If there's any sort of bleeding or fever, not good signs. Go have your patient be seen, or tell them to be seen. So anybody with IBS, they gotta explore their lifestyle patterns and see like what's triggering it or what they're eating or anything like that. They also have medications to help relax the gut. So example for Xanax, really helps quiet the bowel's activity. Pretty cool. And then provide relaxation. And then you have constipation. Nobody likes to be constipated. Everybody likes to poop. So when you're constipated, life sucks. It's a condition in which the client has infrequent hard bowel movements accompanied by mucus. So basically when that's what they're saying is like, here's like, boom. Like, so here's your gut, nice gut. I'll just draw a picture. I won't even try to do the hand movements. So, here's your intestine, okay? You're going to have something blocking the way. That sucks. Look at that. That sucks. So what's happening is like, but things are still building in there, and you're still going to have mucus, and you're still going to have fluid in there. So sometimes it just like leaks around it. Boop, 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 boop. And then it sometimes just looks like really like, it's like small amount of diarrhea, and you're thinking, oh, well, they're still having bowel movements, they can't be constipated. But really they are, because that little bits of fluid and frothiness and whatever that's coming out is just showing an indication for a big blockage. So things to do is you have your nice enema. Here's your bucket. Wow, this is a terrible marker. Here's your bucket, and here's your little hose. You help get the fluid in there to help really, really hydrate it. Or you have digital stimulation, which is when you literally like go in there with your finger and help activate, like kind of like help the colon or rectum like be really reinitiated to help with peristalsis, to help get that out. Or if it's right there at the rectum, you can even feel like really, really, really like hard rock type poop. Just kind of help get it out, I guess you could say. So, and then there's always the laxatives, which are really nice to give just to push it through. People can be super obsessed with pooping, and so they go, I haven't pooped in a day, something's wrong. Something may be wrong, however, have them drink a big glass of water, maybe a half hour later, it'll all come right back out. So just know that people can be super obsessed with it, especially the elderly. I love them, but they can be so obsessed with it, which isn't a bad thing. So this special consideration just talks about how they're really susceptible to it, which they are, because they lose the need to drink, which makes them dehydrated, which then causes them to not poo. So sometimes just their normal cup of coffee every morning gets the job going. Sometimes that's all they need. So loose watery stew, like I said, may not be diarrhea. They may signify severe constipation. So that's a nice little nursing alert. Okay, so page 1601, diarrhea. It's often accompanied, so this is stool. They're liquid, semi-liquid, and often very light colored. That's just coming in large amounts. Everybody knows what diarrhea looks like. It's not fun. Diarrhea often is accompanied by flatus and severe painful abdominal cramps or spasms, or tenesmus, spasms, which defecation relieves. Usually diarrhea, though, can cause dehydration, and then that could lead to hypovolemic shock. So this little special consideration lifespan, giardia, that's when you drink contaminated water or food. Not fun. You're going to take Flagyl, okay? It's going to help relieve it. But basically, if you just like keep pooing and puking everything out because of a weird bug you just ingested, you're not going to have any more to poop or puke out, which means dehydration, hypovolemia, which we know is a loss of circulating fluid, which is shock. So, also, C. diff is a super big thing you're going to learn about in your clinical practice. So C. diff is an anaerobic bacterium that can be normal in the intestine, but when exposed to antibiotics, it can produce extensive amounts of the bacterium and lead to the development of toxin A and toxin B. C. diff, or C. difficile, is often the cause of severe watery and bloody diarrhea. Not fun. Once you smell it, you know it. Okay, so treatment basically is help replace that fluid loss, help them with what's called the BRAT diet, bread, rice, applesauce, toast, things that help stop, like, bulk things up. And then just replacing their fluids either with them drinking or IV. Okay, then you have inflammatory bowel disease. It's a general term for ulcerative colitis and Crohn's disease. Not fun. So you have irritable bowel syndrome, which is just like a frustrated gut, whereas inflammatory bowel disease is ulcerative colitis and Crohn's disease. Know the difference, don't get them confused. So ulcerative colitis involves inflammation and ulceration of the mucosa and submucosa, the colon's lining. Usually with ulcerative colitis, it increases your chances for cancer. That sucks. Then you have Crohn's disease, which is the inflammatory process of the entire thickness of the bowel wall. So, ulcerative colitis, inflammation, ulceration of mucosa and submucosa, and then Crohn's is the entire bowel wall. So, typical signs are diarrhea, blood and mucus in the stool, abdominal pain, cramps, urgency, bowel incontinence, appetite loss, weight loss, fever, nausea, and vomiting. Also know with any sort of bowel disorder or like loss of amounts of fluids, you're going to get electrolyte imbalances. Super important to help replace them, check them out with a blood test, etc., etc. So, in college, I went to school in North Dakota, and over there's a lot of German descent, and I met a lot of people that had Crohn's disease. And so one time I looked it up, this is a long time ago, and I'm not really sure, but they said that there could be a correlation of Crohn's disease with like German ancestry. So if you're German, you may be susceptible to Crohn's disease. Anyways, though, treatments for these of the inflammatory bowel disease is like antidiarrheal medications. Steroids are a big thing that they do to help with the inflammation, and sometimes antibiotics may be indicated for flare-ups. So the nursing alert, though, is that clients are weaned off steroid medications slowly and systematically. They must not stop these medications suddenly. Steroids suppress normal secretions of the adrenal gland and abrupt discontinuation.